African trypanosomiasis, more commonly known as African sleeping sickness, has two types, East African and West African. Both types are spread in the same way and are life-threatening. However, they each present differently and are treated with different drugs. Since the West African variation accounts for 98% of all reported cases, this report will focus mostly on that particular form of the disease. This picture shows the populations that are the most at risk of contracting sleeping sickness. It is difficult to determine exact numbers of this disease since the populations at greatest risk are in remote areas and have little access to health care. More than 70% of the reported cases in the last 10 years have been in the Democratic Republic of Congo. West African trypanosomiasis is caused by a blood-borne parasite called Trypanosoma brucei-gambiense. It is spread by the bite of the tsetse fly, which is native only to sections of Africa. Tsetse flies live in forests, bushes, and vegetation, especially along streams. Many insects are most active at night, but tsetse fly bites usually occur during the day. Oftentimes, people don't even know that they have been bitten, which contributes to this disease's difficulty in being diagnosed. Although rare, this disease may also be transmitted from mother to fetus in a blood transfusion or during sexual activity. Cases of this disease can be seen as far back as recorded history. There have been 3 major outbreaks in modern history. The first one began in 1896 and lasted through 1906 and mainly affected the populations of Congo and Uganda. It is estimated that 300,000 people died in Congo and 500,000 people died in the Uganda region. This prompted an intensive investigation into the disease to develop a cure. The next major outbreak began in 1920 and lasted until the late 1940s. This outbreak contributed to the development of control measures for the tsetse fly in an attempt to eradicate the cause instead of simply treating infected patients. The mid to late 1960s saw the decolonization of many African countries. As a result, their economies suffered and healthcare declined. After a decade of this disease being under control, population screening fell drastically. As the population screening and treatment declined, cases of the disease began to increase. Access to health care was more difficult, so it is estimated that there were many more cases that went unreported. A steady rise in cases occurred from the 1970s through 1990, when a new drug treatment was introduced and population screening rose again. West African sleeping sickness presents in 2 stages. The first stage of the disease is the hemolymphatic stage, where the parasite is present in the blood, subcutaneous tissue, and lymph. The initial symptoms may not appear for weeks or even months after exposure has occurred. When symptoms do appear, they are not disease-specific and can make early diagnosis difficult. Early symptoms include headache, irregularly occurring fever, fatigue, general malaise, muscle and joint pain, swollen lymph nodes, and weight loss. Later symptoms of stage 1 can include cardiac complications, enlargement of the liver and/or spleen, disruption of the endocrine system, and fertility issues. The second stage of the disease is the meningoencephalitic stage, which literally means inflammation of the brain and meninges. The disease enters stage 2 when the parasite crosses the blood-brain barrier and begins to infect the central nervous system. The parasite is then present in the cerebrospinal fluid. In this stage, patients present with the sleep disturbances that give this illness its name. These include reversal of the sleep pattern in which the person sleeps during the day, has insomnia at night, and can sleep for excessive amounts of time. Other signs that central nervous system has been infected include extreme lethargy, personality and behavioral changes, sensory system disruptions, problem with balance, speech and vision disturbances, anxiety, and irritability. Once the disease reaches stage 2, immediate treatment is essential. If left untreated, this disease almost always results in death. The treatment options for sleeping sickness are different depending on the stage of the disease. In stage 1, the treatment is a round of injections of an antiprotozoal drug called pentamidine. If treated at this stage, prognosis for the patient is good. Stage 2 is not so promising. The drug that has been used the longest to treat the infection once it reaches stage 2 is melarsoprol. This drug is derived from arsenic and comes with many adverse side effects. It is being utilized less often in favor of the newer eflornithine. While this drug is less toxic, the administration schedule is very strict and can be difficult to employ. Prevention of this disease is difficult but possible by avoiding the tsetse fly. If you will be going out where exposure to the tsetse fly is likely, wear long-sleeved shirts and pants made of medium weight material and in neutral colors. Avoid contact with bushes and other wooden areas where the flies are likely to be living. Tsetse flies are attracted to the dust and movement of vehicles, so they should be thoroughly checked before getting in. African trypanosomiasis is a very serious, potentially deadly disease that is still active in parts of Africa. It is a blood-borne parasite that is spread by the bite of a tsetse fly. Infection occurs in 2 stages. This disease remains difficult to diagnose because of the length of time between exposure and the appearance of the first symptoms, and also because the symptoms of stage 1 are nonspecific, often leading to misdiagnosis. Although the treatments themselves can be toxic, once the disease is diagnosed, immediate treatment is essential to prevent it from progressing to its almost inevitable conclusion of death. African trypanosomiasis is a complex condition that is challenging to prevent, diagnose, and treat.